Senators Bacon and Gardner, thank you for being here. Representative Sheehy, thank you for being here. Chairman Chip Hubbs, former OHA board chairs Jack Bartell, Bill Harding, Tom Selden, and Phil Innan, former AHA board chair and I'm board member, and my good friend Scott Mullaney, my dear colleague Heidi Gartland. It is an honor, it's truly an honor to be with you here today. And it's always great to be with Mike Abrams. Now, I know that you are all familiar with the strong and creative leadership that he has provided right here in Ohio. I get to see him at the national level. And perhaps you don't fully realize that at the national level, Mike is someone that is really respected by your congressional delegation. He is really respected by his colleagues across America. And he's a guy that never hesitates to ask the tough questions, and he has made some very thoughtful contributions to the development of our public policies on the federal level as well. And most importantly, he has been a good friend, a great partner, and a first-class professional. And it's already been referred to it in some ways like any other great leader. He surrounds himself with a great staff. And we honor today the OHA team that is here as well. Now, under Mike's leadership, we have seen OHA make really significant progress. Progress in expanding coverage to the uninsured, progress in improving patient safety and quality, particularly in the area I think he mentioned of reducing infant mortality, and progress in providing environmental stewardship through a nationally recognized energy and sustainability program. So, you know, I think you all know that centennials only come around once every 100 years. So that's why I'm especially honored to be here today. And as has been referenced, AHA and OHA share a proud history. AHA was founded in Ohio as well. We started out in Cleveland in 1898, so just 66 miles and about 15 or 16 years separate the founding of these two organizations. And as you've heard, Ohio is the first state hospital association, and you have a lot to be proud of. This organization has so much to be proud of. Hospitals are a cornerstone of our society, and that's who we represent. And you employ over 250,000 Ohioans, and you are the biggest employer in 77 of 88 counties in this state. Hospitals are pillars of their communities, and we provide over $3.2 billion in community benefit on an annual basis. And we provide essential public services. Just last year in Ohio alone, you provided over 400,000 inpatient surgeries, over 34 million outpatient visits, and you took care of over 141,000 brand new babies. That's really something. The leaders who brought Ohio's hospitals together in 1915 clearly understood that working together, an association can accomplish certain things that individual hospitals couldn't do individually on their own. And when you think about it, that is the essence of an association. And I know that throughout the years, the staff of OHA, like those of us on the AHA staff, have always gotten our inspiration from you. You, the members of the hospital community, and it's because of what you do day in and day out in terms of taking care of patients and the communities that you serve. Now, 1915 was a very different time in so many ways. America was on the threshold of World War I. Antibiotics had not yet been discovered. Professional nursing was in its infancy. But the one thing that we have in common with the past is that hospitals, as Mike said, have always been there to respond to a crisis. When OHA was established, a terrible influenza pandemic that would kill millions of people was just around the corner. And today, hospitals are prepared to respond to everything, from natural disasters to terrorist attacks to Ebola and so much more. Several generations ago, the big challenges that folks faced were communicable diseases and problems associated with pregnancy and early childhood. Today, the real epidemic of the future in our lifetime is going to be chronic care management. Just think about this. 14% of Medicare beneficiaries have 6 or more chronic conditions, accounting for 93% of what we spend in the Medicare program. Today, unlike in 1915, the most common challenges are hypertension, high cholesterol, heart disease, arthritis, diabetes, and many cancers are now beginning to evolve as it's rapidly becoming a manageable chronic disease. And we're finding new, more efficient ways to help patients that are suffering from multiple chronic conditions so that they could take charge of their health and lead healthier, more productive lives. And we're doing that by experimenting with innovative techniques and then sharing what works and what doesn't work. And that's where associations like OHA become such important platforms for collaboration within our field. While we are here to celebrate and honor the past, and we stand on the shoulders of those that came before us, the visionary leaders who established OHA, you know what they would want us to be doing right here today? They would want us to be focused on the future, just as they were. So today, we need to focus on how we will provide care for future generations. And we have to do that by continuing to transform our organizations so that hospitals will continue to play a leadership role in their communities. And I think it's fair to say that we're all on a journey in transforming healthcare in this country and what we often call redefining the H. And what do I mean when I say redefine the H? Well, it means that each hospital must consider which path will allow it to best serve its community in the future. And some of us will continue to focus on very important services that take place in our buildings, whether it is providing trauma care, sophisticated surgery, diagnostics or therapies that are often on the edge of scientific development. Others in our field will be focused on population health for an attributed population, or taking responsibility to coordinate care so that patients get the right care at the right time in the right place and are not bounced around from one provider that's unconnected to the next provider that is unconnected. And many of us will be seeking strategic partners as we work to reshape and improve care and focus on wellness and prevention. In the new economics of healthcare, we in the field will be challenged like never before to provide increased value to patients. And we will be challenged like never before to demonstrate that healthcare is an investment, not just an expense to the purchasers of care. We will be challenged to provide care on demand in a more convenient manner to patients, whether that is in the form of same-day appointments, walk-in care, ED fast tracks, patient portals, or telehealth, or in some cases, home care visits by doctors making house calls all over again. The reality is that we are all pursuing in our field multiple pathways in the noble cause of taking care of people. The reality is that many of us across this country and across this state are at different starting points. The reality is that many of us are moving at different speeds. The reality is that many of us are operating on different schedules depending upon the communities that we serve and the markets that we are in. And the reality is we are all engaged in massive experimentation. But we still have so much in common that will be the focus of our association's work, both at the federal and the state level. No matter what pathway you are pursuing, OHA and AHA will be there for you in laying out the options, helping you assess them, and partnering to transfer knowledge and provide tools to help folks navigate the best pathway to the future. And no matter what pathway one is pursuing, The AHA and OHA together will be there for you, advocating on your behalf. Because you see, no matter what pathway you're on, we have a common agenda when it comes to public policy issues. No matter what pathway you're on, we share the need to preserve and extend coverage expansions. We share the need to break down legal and regulatory barriers that get in the way of hospitals and doctors working together. We share the need to have professional liability reform. We share the need to expand opportunities for telemedicine. We share the need to create better standards to ensure for interoperability of medical records. And we share the need to prevent additional budget cuts in Medicare and Medicaid. We share all that. It doesn't matter what pathway you're on. Moreover, I think it's important to recognize that all of you in the hospital community are really focused and working on the right things. And your associations continue to work hard to find ways to help you do your jobs better as you seek to improve quality, reduce readmissions, eliminate disparities and variation in care, and increase diversity in our workforce and in our leadership. Not to mention to take efficiencies and to find new efficiencies and take cost out of the system. So we sure do have a lot on our plates. But as Teddy Roosevelt once said, far and away the best prize that life offers is the chance to work hard at work worth doing. And as the famous management guru Peter Drucker once said, even small healthcare institutions are complex, barely manageable places. Large healthcare institutions may be the most complex organizations in human history. But you know, as tough a job as you guys have in the hospital field and women, my former boss, Dick Davidson, used to remind us that in comparison to other leaders, you all have something that no one else has. Even on the worst days with lots of issues and challenges galore, you know, you can turn off the computer and you can shut down the smartphone and you can walk the halls of your hospital. You know, you can go hang out in the emergency department and be reminded every day of how much people in your community depend upon the existence of that ED as a safe haven, no matter what problems they face. You can go to the rehab unit and talk to people who all of a sudden are going to find themselves almost back to a normal life because of the skill and dedication of the people who work in your hospital. And you can talk to the nurses, the doctors, and other caregivers and ask them what happened that day to make them feel good. And they will inevitably tell you something about patients and patient care. You can go visit the coronary unit and talk to patients who wouldn't be alive if the same event happened to them 25 years ago. And you can go to the newborn nursery or the neonatal unit and witness the real miracles that take place every single day. So we have to constantly remind ourselves that no matter how bad your day might have been, it was worth every minute of it to be a part of the great work that we do. And what other leader in any other organization in America can take a challenging day and turn it into that kind of inspiration? A former chairman of our board once reminded us when he said, you know, there are few organizations in society where their people are often referred to as angels, their outcomes are often referred to as miracles, and their work leads people to pray and to have hope. Now, I know I keep talking about the H and how it is changing. And no matter how we redefine the H, we represent organizations and people who are very special and occupy a very unique place in society. And you know, sometimes that blue H that you see out there on the side of the road, it's a special symbol that we all share in common. It's one of the most common symbols known in society, and very often it's taken for granted. But it symbolizes something that people believe in and depend on. And we must always be reminded about how special this sign is. To many people, that H means hope. And as we discussed, the word hospital that is often viewed as a building that provides emergency and inpatient care services, we're evolving as we try to provide a full range of services across the continuum. So we have a real challenge to redefine that word, because, to borrow a slogan, it's not your father's Oldsmobile. And Oldsmobile is no longer in business because they were kind of out of touch with their consumers. And in the words of a former U.S. Army general who served as the chief of the Joint Staff, he said, if you don't like change, you're going to dislike irrelevance even more. And that's certainly a challenge that we face. But the one thing that this sign represents and can never be redefined, and something that we own, is the fact that the H represents a sense of security and safety, unlike any other symbol in society, because that sign says, follow me, because the people who work there will do the very best for those under their care. And that sign says that the people who work there, like so many of you, have dedicated their lives to meeting the highest standards of excellence, ethics, and professionalism. So in the midst of all of the turmoil in the healthcare field and in our political environment, it is these fundamental principles and values that are the bedrock of our past and those who came together here in 1915. They are our fundamental values and principles that will get us through an uncertain present and the future, and they will make us even more valuable players to our communities in the future. Let me just conclude by saying this is a very special time to be in healthcare. And while it can be frustrating and challenging as we try to address some very tough issues, it is rare when any generation has the ability to impact their field and their profession in the way that we do today. Robert F. Kennedy captured it best when he said that few will have the greatness to bend history itself, but each of us can work to change a small portion of events, and in the total of those acts will be written the history of our generation. Fact is, our field is on the edge of a revolution as a result of changes that are taking place in science, in information technology, and in the management of care. And we all have the opportunity to build a system of care that is more equitable, transparent, and responsive, that keeps people healthier. We have the opportunity to improve quality, safety, and the entire patient care experience for our children, our children's children, and their kids too. And wherever this journey takes us and however we redefine the H, we will endure like those who gathered here 100 years ago, because they recognized that we have a sacred mission in caring for people from the start of life to the end of life and at every stage in between. And we will endure like those that came together 100 years ago. We will endure because of who we represent. We will endure because of what we represent. We will endure because the H, however you define it, will always mean healing and hope. We will endure because the H, however you define it, will be critical to the health of all Americans. And we will endure because the H, however you define it, is a key strength in our country's future. So I'm honored to be on this journey with you this week and on this day and in the years to come. And I thank you so much for allowing me to be a part of this special celebration. I congratulate you all and thank you for what you do day in and day out in taking care of people. Thank you.